Hi, everyone. This is Jennifer Coons, one of the reference librarians at the Haverford Township Free Library, with your COVID check-in for June 18, 2020, where I try to untangle some of the latest news stories about the disease, as well as show you some interesting online resources that can help amplify your understanding of what's going on. So today I wanted to talk about two stories. One of the news stories was a big deal last week. On June 8th, Representative Maria van Kerkhove of the World Health Organization made a statement, and I quote, "From the data we have, it still seems to be very rare that an asymptomatic actually transmits onward to a secondary individual." And I'm sorry, this is my dog. She needs to be in the room with me because there's other stuff going on in my house. So occasionally the dog will want to weigh in on what's happening. But yeah, so this quote, it apparently is not entirely true. And so people were confused, and it drew a lot of disgruntled responses from the larger research community. So mainly because there is quite a bit of evidence that asymptomatic, it's not direct evidence, but they're pretty sure that asymptomatic carriers, and this could be pre-symptomatic or asymptomatic, it could be people who don't show any symptoms but have the disease and will then go on to be very symptomatic, or people who are infected who are not showing any symptoms through the duration of the infection, that it is possible for those people to transmit the disease. And the reason that we know this is that there was a lot of testing and contact tracing that went on in Singapore and also China that showed that, for example, in China, families, I'm going to go to the next slide here just to say, that families, there were family members, like you had some family members who were very symptomatic and were sick and staying home, and then you had family members who were completely asymptomatic, but tested positive. So, and the big takeaway is that if you are symptomatic, you will stay home because you'll be sick, and usually people stay home when they're sick, and especially now we're told to stay home if we're sick to keep the disease from spreading. If you're asymptomatic, you don't know that you're sick, so you'll be walking around, and then people around you don't know that you're sick. And the disease does one of the things that makes COVID-19 so contagious is that it actually resides in the upper respiratory system. So it's easier to come out in your viral, as viral air droplets, rather than SARS, for example, was actually resided in the lower respiratory system, so it was not quite as contagious. So the takeaway here is, it's just for the regular person who wants to assess their risk, is to kind of just to be on the safe side, assume that people that you're around could be infected and they're just asymptomatic. So that's where the social distancing and the mask wearing, on an individual level, that can help you to feel a little better. But on the larger public health level, it's important. This is why widespread testing is so very important, because it gives us more information on who has the disease and who is not showing any symptoms at all, and then being able to isolate those cases so that people aren't going out like Typhoid Mary and infecting and not knowing that they're infecting other people. So that was that story that I just wanted to unpack a little bit for you and talk about that. And apparently, so what happened was Maria van Kerkhove, who's in this image right here, she actually had a press conference, a Q&A, the day after she had made that statement about asymptomatic carriers transmission being rare, and she clarified the statement. And so, okay, anyway. So now I'm going to talk about the major news story this week, which is this increase in cases in a lot of the states in our country. So we have especially Arizona, Florida, Oregon, Arkansas, Alaska, North Carolina, South Carolina. So among other states. And bars and restaurants seem to be, according to what we're seeing, seem to be the sort of mini epicenters of these new outbreaks. And they're finding that people who have just gotten together with a series of friends, with a group of friends to go to a bar or a restaurant, have then 6 to 10 days later shown to have fallen ill. Saturday, the 13th, Florida saw its largest single day case number. So they had over 2,500 cases that day since the start of the outbreak. And it appears that for the most part, all these new cases, this uptick in cases, has not a lot to do with an increase in testing. It's actually because what they're finding is that the hospitals are being overloaded with sick COVID patients. So, and then they're being tested. So it's not just that people are being tested, and that's why they're finding this uptick in cases, is that they're finding that the hospitals being the record numbers of people going into the hospitals who are sick. So to give some perspective about numbers, the national peak for this country, which occurred on April 10th, it doesn't mean there might be another peak. This was the peak thus far, occurring April 10th, was 31,000 cases per day. And by mid-May, just as a result of the shutdowns and the social distancing measures, the cases dropped to about 22,000 per day and stayed somewhat steady for the next 4 weeks or so. So all the health officials agree that this is not a second wave. What's going on here just has to do with the reopenings. So I'm going to talk about 3 factors that have to do with disease transmission, and also show you some modeling, some more scientific modeling that data scientists have come up with. But one of the numbers, I want to talk to you about a scientific term, and I should have written it down on the slide, but I didn't. This is called the R0, or reproductive number, or R0. It's really RO or R0, but people call it R0, NAUGHT. And this has to do with if one person becomes infected with a disease, it's like a mathematical ratio of how, assuming that no one in the community is immune to the disease at all, and no other interventions take place. So no social distancing, no nothing, and no one is immune. This ratio or mathematical number will show how many more people will be infected exponentially. So the R0 so let's say the R0, so with COVID, the R0 was about 2 when we first saw it, which meant that if one person was infected, they would then go on to infect 2 people, who would then go on to infect 4 people. Those 4 people would go on to infect 8 people, who would go on to infect 16 people, and so on and so on. So it's an exponential ratio. It's not static. It's based on different. So that assumes that nobody in the community is immune and no other interventions take place. So this number moves around depending on interventions and the level of immunity in a community. I hope that makes sense. Over time, epidemiologists have they've assigned R0 numbers to different diseases. So to give you some perspective, for example, the measles, which is incredibly contagious, has an R0 of between 12 and 18. This is an R0 of 2. Imagine if you had an R0 of 12, how many people would become infected exponentially over a period of time. So what we're trying to do with COVID-19 is to keep the R0 under 1. So once the R0 is 1 or below, you can manage the spread of the illness and it doesn't become overwhelming. So let me take a break here and tell you how the SARS-CoV-2 number, how this R0 number came to be. And it was a data scientist named Yueyang Zhu, and I hope Yueyang Zhu, yes. And he created this amazing mathematical modeler that shows how the disease progresses through using this R0 number, which I don't really understand because I'm not good at math, but I'm so glad other people do it and they're really good at it. So there's this cool website where he describes the whole methodology behind it, how it works, how he gets his numbers. And then here's an example of one of his projections for the state of Pennsylvania. and he's actually he's showing deaths, current deaths, and then this line in the middle is sort of today, and then this over on the right hand side here is projected, and he's projecting this number of deaths by October 1st. But that's a projection. It depends on different factors, different kinds of interventions or non-interventions. So he's using the RO number, the R naught number, to come up with these projections, along with a lot of other fancy mathematical, statistical techniques. Okay, so that's the R naught number. So anyway, the reason. So as I said, the reason that the R naught number decreased for us was a direct result of the stay-at-home orders. And then the RO number is increasing now that states are opening up. Now we have to open up. It's just a question of how do you open up and also balance public health, safety. So it would be you do it very, very carefully. And so the actions include ramping up the testing so we know who's ill and who is not ill. We can isolate those cases, isolating new cases, widespread mask wearing, and social distancing. Sorry, I sound a little bit like a broken record here. The next factor I wanted to talk about is this idea of seasonality and what happens when the weather gets warm. Like there's this other cool research team at the University of Washington, and it is they have an Institute for Health Metrics and Evaluation, and they do a lot of forecasting. So they were trying to figure out, well, what is it about the warm weather? The RO did go down in the past month, so there was some social distancing, but did it also have to do with the weather getting warm? And the bottom line is, I don't really know. Is it that the air droplets from the disease don't stay in the air as long when it's warm, or is it that people are actually intermingling, not so much in indoor spaces, but in outdoor spaces? And if you are in the outdoors, it is the transmission is less of a threat because you're in a much larger airspace. But they don't really know, but more may be revealed over the coming months. So the bad news is that based on their modeling, they think there may be a powerful increase in cases starting in September, going all the way through February. But that avoidance of large-scale social contact, especially in indoor environments, along with widespread mask use, could help keep the increase from being as steep. So I'm going to show you some of their modeling that they do. And as you can see up here, so this is the United States of America. This is the modeling this is the total deaths. And so this number here is the total deaths thus far. And then the dotted line is, and everything, and this is today, this line, this vertical line here is today. And then these are projected deaths. And if you were on the live website, your cursor travels along this line, it'll show you exact dates and exact numbers. It's very, very granular and very interesting to look at. I mean, if it wasn't so depressing because we're talking about deaths, but it is very informative. So you also see you have total deaths, you have daily deaths, infections and testing, hospital resource use, and social distancing. So he's measuring all of these things, and then they look at all that data together, and then they come up with an overall projection. So here is another, this has to do with social distancing. So again, if you were to move your cursor along, I can't do this because I'm not on the website right now, but if I was, each date, like right here is maybe like March 13th, that's when the library closed. And then there's a steep decline in, socialization, because or I guess an increase in social distancing. So like by April 1st, there were shutdowns all over the United States, and then slowly started to reopen. And then here are his projections for the opening up and more social interaction. This next screen is showing the daily death curve. And then this one is showing hospital resource use, which is really interesting too. And so they take all this information, like I said, and come up with their projections. All right. The last thing I wanted to touch on was this idea of the protests and marches that have been going on, where a lot of people are getting together. It is in outdoor spaces, but they're and how this might affect public health and cases. So so it is difficult or even impossible to calculate cases or deaths that may have resulted from recent large-scale protests and demonstrations, and that's because there's no real accurate count of protest participants. There's no way to really to determine how many people were in these protests, and so then you don't even know a lot of who they were, so you can't contact, trace, or follow up with them. There's also little research regarding outdoor intermingling of this type. They do know that the larger the airspace, and outdoors is less of a risk than being indoors, but that's all they know. They don't know anything more detailed than that. And people were quite close to one another in these marches and protests, but they were also outdoors, and yet they were also chanting and yelling a lot. So, but many of them were also wearing masks. It's hard to tell. This is too many factors and a lot of unknowns. So the bigger question, though, is will transmissions that occur from these protests and marches, and there certainly will be transmissions that occur, will those lead to a lot more cases down the line? So that means will the infected, if someone gets infected who is a march participant, go back into environments where there's a high level of transmission? So will they, maybe infect household members or, family members, roommates? Do they have jobs that are in high-risk environments, like grocery stores or healthcare facilities? To sum it up, Mark Lipstitch, who is an epidemiologist at Harvard, says how much transmission happens later on is far more dependent on our actions as a society and whether we can suppress transmission around the country than on how many people actually go to protests. So it basically has to do with what, it's like what I've been saying throughout this presentation, which is, so the more widespread testing you do, the more isolating the new cases, the more sensible social distancing while opening up the economy will tell us more, and we'll have possible protective measures over too many people becoming ill. All right, that was a lot to unpack. I hope some of it made sense. Thank you so much for joining me again. Happy to be with you. And I'll see you next week with some new interesting news, I'm sure. All right. Let's say bye-bye. Stay well.